Hello dentist, how are you today? I hope you're fine. Today we're going to talk about gingival diseases and periodontal diseases. So we're going to talk about the types of the gingival diseases and types of periodontal diseases. Then we discuss the classification of periodontal disease, and then we go to treatment of or management of juvenile periodontitis, and finally we're going to discuss the indications of periodontal surgery. Okay, before we start our topic today, I want you to subscribe to my channel and hit the notification bell for more videos. Okay, let's start now. So gingival diseases could be gingivitis and necrotizing ulcerative gingivitis. Periodontal diseases could be aggressive periodontitis could be begin with the early onset periodontitis, which is prepubertal juvenile periodontitis. Then the aggressive periodontitis changes into rapidly progressive periodontitis. Adults, then the other type we have other types we have for periodontal diseases: the adult periodontitis and necrotizing ulcerative periodontitis. And then finally we have the HIV periodontitis. Let's see how do they look like on the slides. Gingivitis, this is how it looks like. Patient having, this is how, can you see the red here? It's all red, inflamed, the gingiva is inflamed, okay, all around. Then we have aggressive periodontitis. Can you see a lot of calculus here? You can see, and recession, and then we have bone loss, a lot of bone loss and inflammation, and of course bleeding. Then if we, here in this case here we have this, can you see the level of bone is really very low here, okay, and the teeth are loose, okay, and there's a lot of inflammation around the teeth. Okay, so this is, we call it aggressive periodontitis. Severe, aggressive means very severe. Necrotizing ulcerative gingivitis. Let's look how it looks like. This is, okay, this is how it looks in simple cases, and then we have severe cases. This is how it looks like. Necrotizing ulcerative gingivitis. HIV periodontitis. This is a slide of a patient having HIV periodontitis. Classification of periodontal diseases. Let's see how we're going to classify the periodontal diseases. They are classified into chronic periodontitis, aggressive periodontitis, periodontitis on manifestation of systemic disease, necrotizing periodontal disease, abscesses of periodontium, periodontitis associated with endodontic lesions, development of acquired deformities and conditions. Okay, so this is the classification of periodontal disease. Again, they are periodontal diseases are classified into chronic periodontitis, aggressive periodontitis, periodontitis as a manifestation of due to systemic disease, necrotizing periodontal disease, abscesses of the periodontium, periodontitis associated with endodontic lesion. Then we have development of acquired deformities and conditions. This is how the aggressive periodontitis. An aggressive periodontitis occurring in a healthy adolescent, characterized by rapid loss of connective tissue attachments, okay, and there is loss in the attachment fibers, okay, and the alveolar bone loss. There is also alveolar bone loss. Usually it's localized to the incisors, so it occurs in the incisors and first molar, okay, or it may be generalized all around the teeth. Generalized means all around the teeth. Recent use of cone beam computed tomography (CT) has shown that these features, traditionally thought to represent an association of the inferior dental nerve and tooth, may not be as accurate as previously thought. Okay, more work is needed to determine the accuracy of these features. Management of juvenile periodontitis. Let's know now what is the management of juvenile periodontitis. So first thing, you give the oral hygiene instructions. Of course, you're going to tell the patient what to do, give mouthwash, how to brush his teeth, okay, and so on. Microbiology culture and sensitivity, MCS, subgingival flora, okay, scaling and root planning, okay, root surface instrumentation and or access, or you may access flap surgery. Of course, you can give, you give in severe cases, you give antibiotics. They usually responded to tetracycline as an antibiotic. We consider surgical excision of the pocket lining, okay. So these are the methods for treatment, methods used for treatment of juvenile periodontitis. Again, oral hygiene instructions, this is what you're going to do, and then microbiology culture and sensitivity of the subgingival flora, scale and root surface instrumentation, and or access flap. So you can make scaling, okay, root planning, and or surgery, flap surgery. Antibiotics also are used for the treatment of juvenile periodontitis, and then we consider surgical excision of the pocket lining. Indications. Finally, let's know what are the indications for periodontal surgery. The first indication is the pockets. When do we make periodontal surgery? In other words, pockets, when pockets are greater than 6 millimeters, pockets associated with thick fibrous gingiva, furcation when there is a furcation involvement, mucogingival deformities or extensive deformities, lesion requiring reconstruction or regenerative treatment. Short clinical crown requiring increase in clinical crown height. Also gingival hyperplasia. So these are the indications for periodontal surgery. Let's revise them again. Pockets, when the pockets are greater than 6 millimeters, pockets associated with thick fibrous gingiva, furcation involvement, mucogingival deformities or extensive periodontitis lesion requiring reconstruction or regenerative treatment. Short clinical crown, okay, when the clinical crown is short, requiring increase in clinical crown height. To increase the clinical crown height, in order to make periodontal surgery, to increase the clinical crown height. And in case of, finally, in case of gingival hyperplasia, and we talked about it before, okay, when the gingiva is puffy papillae, okay, and there is swollen, it's also swollen and it bleeds, okay. So I hope that today's lesson or topic is of interest to you, and I'm sure it's very common, and I'm sure you're going to get a lot of information, and it will help you in the exam questions, okay. Good luck in your exam.